So welcome to this webinar this evening hosted by Mental Health Australia and the Australian Digital Health Agency on My Health Record. My name is Ingrid and I work with Mental Health Australia. I'll start by giving a brief intro and then passing to Kathy from the Australian Digital Health Agency. So first, I'd like to acknowledge the traditional custodians from the lands on which we gather from right across the country and pay our respects to elders past and present. We particularly recognise the ongoing contributions of First Nations people to mental health and wellbeing holistic ways of understanding around social and emotional wellbeing. We also recognise the unique contribution of people with lived experience of mental health challenges and those who love and care for them in championing change in Australia's mental health system. Thanks to everyone for attending today or for joining us later online to discuss My Health Record and Mental Health Advanced Directives. My Health Record is an opportunity for people to have more ownership and control about our own healthcare information, to communicate our preferences for care and to have more integrated healthcare. But we know there's also still a long way to go in ensuring that health providers are making the most of My Health Record and that people accessing services know how to use it as well to get the best outcomes from it. So hopefully this webinar will assist in that. So earlier this year, Mental Health Australia partnered with Lived Experience Australia to do a brief little survey to understand more about people's experiences with My Health Record. So for this survey, we had 650 people who identified as having lived experience of mental health challenges. We're using the term lived experience here rather than consumer. We had about 240 people who identify as having experience supporting someone with mental health challenges, so calling that term mental health carers here. So from that sample, about 70 to 80% of people said that they have a My Health Record. About 40% said that they use it. Just over 70% were aware that you can nominate a representative to help manage the record, and Kathy will talk a bit more about that. And a bit fewer, about 60 to 70% were aware that you can control which health professionals can access what information in the record. So the answers to our poll question earlier, the 5 most common benefits that people identified around using My Health Record for them. The most common one was convenience while travelling, that if you're away from home and seeing a different health professional than a regular health professional, they can still access key health information. Not having to need to remember or use paper copies of documents, being able to keep all the health documents in one place, choosing which health professionals can see what information, and potentially fewer delays in accessing treatment if health professionals have that information at their fingertips. There are a few concerns that people raised around security of information online, incompleteness of records, that it's not as useful if not all the information is in there if health professionals aren't uploading it. Some concerns around misinformation if people disagreed with the reports that health professionals had and then not being able to provide context around that if it was entered into their record. And unfortunately, still concerns around stigma and discrimination, that if people had a mental illness diagnosis in their My Health Record, concern of being treated differently by other health professionals. I just wanted to read out this quote in pink. So these quotes on the left are in people's own words. Some of those are the positives and some of the challenges around My Health Record. I think this one in pink kind of captures it well. So they said, having access to my own health information in one place has been very empowering and important to me and my family who have chronic health issues. My negative experiences with it have been from healthcare providers and hospital services who still need reminding to upload and access my information. So we asked people overall, what's your experience with My Health Record? And about 45% of people said, yeah, positive or really positive. 40% of people were neither here nor there, pretty neutral. And 16% of people said they had a not so good or negative experience. Over half of people that we surveyed wanted more support to understand how My Health Record works. So our conclusion from these really brief research is the majority of people were willing to use My Health Record, but we still need changes so that providers are using it consistently and so that people accessing healthcare understand My Health Record and trust it, and so are able to make the most of it. And that's part of what we're here today to do. I also wanted to talk briefly about mental health advanced directives. So this can be a pretty complex area, but they're documents that people can make to tell health professionals how we want to be treated if we become unwell. It's called different things in different states and territories, and the legislation is different in different states and territories around Australia. So it's strongest in ACT and Queensland, where it's more legally binding. In other places, it can be a document that's just provided as guidance for health professionals to consider. But really, it's about being able to communicate preferences for care if somebody is sectioned under a Mental Health Act and has to go into care, where you can say who'd want to be contacted if you have to go into hospital, what treatments you would or would not like to receive. And if the document is uploaded into My Health Record, it means that health professionals can have much easier access to it. It means that they can be aware that it's there, and you don't have to remember to carry around paper copies of it to provide that to health professionals. So it's about communicating choices. Only very few people have Mental Health Advance Directive. In our sample of 585, only 15 people had one. But more people said that they would be interested in making one. Only 41% of people knew that they could upload it to My Health Record, but it's a new option, so that makes sense that people aren't as familiar with it. And similarly, only 37% knew that you can update it or remove it at any time from My Health Record. So we've created a couple of resources in collaboration with people with experience, these social media tiles that are around key messages, and this brochure that's available on our website, and I'll put a link to that in the chat. You're really, really welcome to use those resources to share professionally or with your personal networks. They're about just spreading the word that it's an option now to upload Mental Health Advance Directive to My Health Record. So I'm going to stop sharing there now and pass over to Kathy from the Australian Digital Health Agency. We'll go a bit more into the detail of using My Health Record. Thanks, Kathy.
Thanks so much, Ingrid. And can I just confirm that you can see my slides now?
Yes, we can.
Is that toolbar in the way?
Can
I get rid of that? Wonder if I can hide that. Hide floating meeting controls. There we go.
Yes, that's great.
I don't know if I'll be able to change out of it now, but anyway. So thank you very much for having me today, and my pleasure to be here presenting on behalf of the Australian Digital Health Agency. My name's Kathy, and I've been doing a lot of work with healthcare providers and hoping to encourage them to use My Health Record more. But tonight it's more about you and what you can do with your record as well. So I'm going to go through a bit of more detail about what My Health Record is, how you can benefit by having a My Health Record and what you can find inside there, and how My Health Record is set up to keep your information secure, and the things that you can put in place to help increase that security if you want to. Sorry, I'm getting flick downs on my screen. Hope that's not showing up too much on yours. I'll then go through how you, if you are a carer for someone who has lived experience of mental health, how you can help manage a person's My Health Record, or if you are a person with lived experience, how you can ask someone else to help you manage your My Health Record if you do need help with that. We can also go through some of the practical steps of how you actually log in and access your own My Health Record, and also how you can add those advanced care plan documents. So if you do have a Mental Health Advance Directive, and how you can upload it to your My Health Record. So let me just try and make sure my slides are progressing. So first of all, what is My Health Record? Well, basically, it's just a summary of your key health information. So it's not absolutely everything that's held by your healthcare providers in their medical records, and it's not all of their notes or information about you, but just that key information that might be really useful if you go somewhere else in the healthcare system and they know nothing about you, and for them to be able to find out more. As we've said, it's personally controlled, in that you have a say in what goes into your record, and you can also control who can view the information in your record. And I'll give you some pointers on that in a moment. The great thing about it is that it is part of a national system, so that if you are travelling or wherever you go in the health system, hopefully the healthcare providers that you see will be able to access and view your information. And we at the agency are working across a whole range of different healthcare settings to encourage and increase their ability to use the system and see your information. We also have a new consumer app, so an app that you can use to actually share your information as well if they aren't yet connected. And the other beauty of it is that it's accessible at all times. So if there's an emergency situation, then you can have that information wherever you are, and they don't have to try calling back to your regular GP or whoever else is involved in your care. And there are also a lot of security protections in place to keep your information safe within the system. A lot of people have concerns about putting information online, but I'll go through a bit of the protections in just a moment. Ingrid, can I just check, are you still seeing that toolbar at the top of my screen?
We are again.
Let me see if I can hide it again. Is that gone?
Yes, that's good.
Okay. So I think some of you already have touched on some of how My Health Record can be helpful in the survey that Ingrid showed before. One of the key ones is not needing to remember all of your information, so not needing to necessarily remember your medical history or your medicines information. And the key part of that is that you have perhaps had a discussion with your regular healthcare provider, if that's say your GP, and ask them to make sure that that information has been included in your My Health Record. That will then help save you from having to tell the story over and over. And keeping that medicines information updated so that if you do end up somewhere, they know what medications you're taking. It can help reduce the need to have unnecessary tests and scans. If your information's in there and they can see that you've had a particular test done, they don't need to reorder it, they can see the results. And it might mean that you can hopefully have better continuity of care and better quality of care because people have that information to hand. And as we mentioned earlier, you and your representatives can also add information in to your own My Health Record, and you can control who can see it. And over time, it builds up with information, giving a detailed view of your health over time. In terms of what is in My Health Record, there's the information that's uploaded by healthcare providers or healthcare organisations that is listed on the left of this screen. So the main one that comes from your main regular provider is what's called a shared health summary. And that can be really useful to have uploaded because that may have that medical history and save you having to retell that story. So if you haven't had that uploaded and you're going to see your GP, perhaps have a chat with them and ask them if they could upload that for you. Other documents that can be really useful to be seeing in your own My Health Record are, of course, any hospital discharge summaries. Most hospitals are now connected and uploading discharge summaries if you have been an inpatient. Another document is an event summary, and that can be uploaded just for a one-off incident. So if you've perhaps seen another doctor after hours, they can add that event summary to keep track of that after hours encounter and inform other people of what has happened. Specialist letters, test results, and so on. There's also information that flows through from Medicare, and that can be useful in terms of seeing how many item claims you've had under a certain item number in Medicare. Just going to get rid of this again. And the main thing that we'll talk about today is what you can do in terms of adding your advanced care planning documents into My Health Record. But there are other things that you can add, which are listed here. You can also have your own personal health notes, which are private to you and can't be seen by any health professional. So they're just a place where you can keep track of things, but it's a nice way to keep it all in one place so that you can have it to hand if you need it in future. So just going into those protections that I mentioned before in terms of how My Health Record keeps your information secure, the main thing is that it's not accessible by just anyone. It can't be looked up in Google on the internet. it can only be accessed by healthcare providers who've registered and are working in an organisation that's also registered as a healthcare organisation, as well, of course, as yourself or any nominated individuals that you've given access to, and we'll talk about that a bit further on. There's also lots of other ways that My Health Record is protected. In particular, there are settings within this software systems to keep the information safe. There's encryption and firewalls and cybersecurity settings. There are processes within each organisation in terms of how they authorise their staff and who's allowed to look at the information. And in general, it's only meant to be people who are directly involved in your care. And there is specific legislation that covers the use of My Health Record and protections in place in regards to that as well, on top of the general legislation around the Privacy Act. So if you did happen to notice that something seemed a bit strange in your record, you could query it and that could be followed up. So I think in the statistics Ingrid shared before, I think it said that I think about 70% of you have a My Health Record. Most people would have one. So it was created automatically for everyone back in February 2019, unless you decided to opt out. So if you chose not to have one, then it wouldn't have been created. But if you didn't, then it would have been created and it might just be sitting there and you might not realize that you actually have one sitting there, and you can probably log in and have a look at it now. If you've arrived in Australia since then, you could have been asked whether you wanted to have a My Health Record, and you can select whether you want to. And if you haven't, or if you find that you haven't got one and you would like to, then of course you can get one set up. As I said, most people in Australia do have one now, and you can see from this page, this is back from February, more than 23.5 million people have My Health Records, and that number's actually been increasing even since we went through that opt-out period, as I think more people have been reassured and understood more about how it can be useful to your health and care to have that information available wherever you go. So just going through some of those privacy controls that you can put in place over your record. As I mentioned, it's only accessible to healthcare providers who are directly involved in your care. And they have to be authorised, working in an authorised organisation, and that's being registered to use the system. But if you want to put extra controls over your record, you can. And one of the things you can do is put a control over your whole record, which is called a record access code. And then only people who you actually give that code to can access your record. So when they go into your My Health Record, they'll get a little prompt saying this has got an access code in place and need to ask you for that code before they can look at it. The other thing you can do is restrict or contain access to specific documents. So you can actually say, I want to keep this document in my Health Record, but it's because it's perhaps got sensitive information in it. I want to put an extra control over that and say I only want it to be accessible, say, to my GP and or my psychologist and nobody else. So if you then ended up in hospital, they wouldn't even know those documents were there unless you informed them and gave them the code to be able to get in. There are some exceptions or some provisos to be aware of if you do put those codes in place. And one is that if there is an extreme emergency situation, healthcare providers can use what's called the break glass function to allow temporary access that overrides those access controls. But that you do get an alert about that if you've set up the alerts, and that can only be used in certain specific situations. So if you want more information about that, we have whole modules that go into a lot more detail about when that can and can't be used or how to set up those access controls. And you can also set up your notifications, so you get an email alert when a new healthcare organisation accesses your record and so on. So I actually have that set up on my mobile phone. If I'm seeing a healthcare provider, I'm usually asking them to look at my Health Record or asking them to add something. And they're then surprised when I get a little alert ping on my phone and say, oh, look, I can see that you've accessed it. We also have security systems in place at the agency that are cybersecurity systems that monitor the use of the system to make sure there aren't any overseas or strange groups trying to get into the system. You can also see within your own My Health record a history of when your My Health record has been accessed, the date and the time, the organisation that was opening the record, and whatever action was taken, so which documents they looked at. So if you are worried that someone's been looking in your record and you think, why were they looking at it? You can pull up that access history and see that detail. And if you have any concerns about why it's been accessed, you can put in a complaint or request to the Digital Health Agency. We've got the details at the end of this presentation. So in terms of how to manage the record of someone you care for, a dependent or loved one, you can have, or if you are a person with lived experience, you can nominate someone to help manage your My Health record. And there's two types of representatives. One is that's called the nominated representative. So that's someone who is a trusted carer or friend that you say, yes, I can have a look at My Health record, but you can too. So you can invite them to look in your record, and you can set how much control they have and what they can do within your record. You can give them complete control. They can see everything and do the same things that you can, or you can just say, yes, I want you to be able to see the information. You'll need to invite people who are nominated representatives to be able to see your record and to give them access to your record if you do want them to help you with that. It can be really helpful. I know that many of my colleagues are nominated representatives for their elderly parents, and that can be really helpful because then they can look at their My Health record and say, hey, Mum, what's going on with this incident that happened? The other option is to be an authorised representative. So this is where someone can be responsible for managing a My Health record for someone who can't manage the record themselves. So if a person has parental responsibility or legal authority or is otherwise appropriate to act on behalf of that individual, then they can be an authorised representative. So in most instances, that's a parent or a carer, family member or legal guardian or someone with enduring power of attorney. There's a whole process to get authorised as a representative. They need to complete a form and get that access enabled to be able to do that. And they do have to still then manage your record in the way that would represent your desires and wishes for care. There are a whole, we have e-learning modules that can support you if you're interested in getting that set up. So if you are looking to be an authorised representative, there's guidance on our training page. There's specific modules about how to become an authorised representative for either a child or for authorised representatives for people over 14 years of age. So very quickly, I'm conscious that we're running out of time. How do you access your own My Health record? Well, first of all, you need to sign in through MyGov if you've got a MyGov account and link your My Health record in MyGov. That'll ask you to verify your identity, make sure it's you, and then you'll set up your My Health record. You'll see a button where you can click on My Health record, and then you'll see a screen like this, and it's saying, welcome to My Health record. If you're a nominated representative for someone, you'll see multiple records along here and you choose the one that you want to access. You usually see your own and whoever else you're a representative for. So for instance, I can see mine and my child's My Health record listed here. And clicking on the button for your own record, you then land on the landing page, which looks like this. You can then work through the little drop-down menus at the top to find various documents to set up your profile settings and privacy and access, as well as that section where you can upload your advanced care plans if you have one. Once you've done that and you've set up your record, you can also use what's called the My Health app, which is really great. It's brand new. It's just been released this year. And it's a way that you can access your My Health record on your mobile phone or any other mobile device. It lets you download documents and share it easily. If you're seeing a healthcare provider perhaps who isn't yet connected to the system, it means you can actually pull it up on your phone and share the information then and there. So I've got a little video which I'll quickly play, which gives you a little bit more information, if I can get out of my screen, about that app. So hopefully, if I do this, you will all be able to hear it.
Hi, I'm Steve Reynolds. When you need to access your My Health record, it can be securely viewed using the My Health app on your mobile device. You'll need to first download the app and connect it to your My Health record. The My Health app will be useful for everyone. You can use the app to safely and securely access My Health record wherever you need it to help keep track of your health information. I have diabetes, so now when I see a doctor and they ask me about my medical history, I can use the My Health app to show and share health information like my allergies, medicines, immunisations, and my blood test results. There's other information I can show them too. It's great having My Health information in my hands. If you're a parent or carer, you may be able to use the My Health app to view My Health record information of your young children or other people you care for. If someone needs to borrow your phone, you can add a PIN to the app to keep your health information safe. My Health is an Australian digital health owned and managed app. It's convenient, easy to use, and allows you to access and share health information when you need to. You can download the app by searching My Health Gov in Google Play or the App Store. For help downloading and installing the My Health app, call the My Health Record helpline on 1800 723 471. The helpline is available 24 hours, 7 days a week.
So I should mention that that helpline is also available if you do need any other help with your My Health record. Feel free to contact it. So very quickly going through the key bits that you wanted to know for this evening around how you can add an advanced care plan, which can include a mental health advanced directive, how to add that into your My Health record. It looks complicated, it looks like a lot of steps, but this is specifically going into the details, so it makes it hopefully easier for you to do. The first thing you need to do is scan your advanced care documents or save a copy as a PDF file onto your computer. You'll need to sign in to MyGov through the MyGov website and then select your My Health record. And then you go to the advanced care planning page. Once you're there, it asks for you to add some details and you can select your advanced care plan where you've saved it and upload it. Review that it's okay, check that it looks right. And then if you want to, you can add information about where else that advanced care plan is stored. So if people need to find a copy elsewhere, they can. But once you've uploaded it in My Health record, that will make it available whenever it might be needed. So once you're in your own My Health record, if you do go to upload it, you will find that this drop-down tab says Documents and Advanced Care Planning. And then if you click on there, you'll see the option to add an advanced care planning document. And that's where you click once you've saved a scanned copy. Clicking on there, you then select this to find and browse to your computer and connect it to the right document, add in the relevant details, and then click Upload. There's some great websites that support information around advanced care planning more generally. The Advanced Care Planning Australia website is listed here, and there's information also for you if you want to go through those steps again on our website. The website also has a whole lot of useful information about all the other things I've talked about this evening. So for further information, we would really recommend some of our learning modules, and you'll get a copy of these slides afterwards so you can click on these links directly, or if you've got your phone out, you can scan that QR code right now. We have some fabulous e-learning modules which take you through key steps in using your record, as well as setting up codes and nominated representatives and so on. So if you want to do any of those things that I've mentioned this evening, I'd recommend looking up those courses. And for more information, you can visit our website, which is listed here, www.digitalhealth.gov.au. And you'll find a landing page there, which is for everyone. And you can click on the My Health Record tile and find a whole lot of really useful information as well.